This is an episode of Unconfined, a podcast of the Johns Hopkins Center for a Livable Future in Baltimore, Maryland. You can find us online at clf.jhsph.edu. Mike Milley is our sound engineer and produced our theme music. Your hosts are me, Tom Philpott, and Christine Grillo. Paulette Wilson is a producer, and Natalie Wood-Wright is the executive producer. The opinions expressed here are not necessarily those of Johns Hopkins University or of the Center for a Livable Future. Welcome to Unconfined, the podcast of the Center for a Livable Future at Johns Hopkins. This is our first episode taping here in our Baltimore offices down by the Inner Harbor. We're extremely excited to present to you Dr. Chris Heaney, who's an associate professor in the Environmental Health and Engineering Department at Hopkins. And he's leading for CLF, for our organization, he's leading the Community Science for Environmental Justice program. And we have Chris on in the context of, as we continue our series on biodigesters in hog country. Chris spends a large portion of his time working with community members in North Carolina's most hog-dense counties to document what it means to live in the shadow of these huge facilities. Welcome to Unconfined, Chris.
Thank you so much for having me, Tom. It's a pleasure to be here.
Yeah, and I wonder if you could start by talking us through this thing called community-based participatory research that you do and that you've done in NC Hog Country for a while. What's the history of it? How did it get started? All that sort of thing.
Sure. So the idea is really simple. It's that, people who are living in communities, they know their neighborhoods. They know the conditions which can positively or negatively affect their environment they live in and their health. And so community-based participatory research starts with listening and trying to understand their lived experiences every day. And so in North Carolina and the eastern portion of the state where concentrated animal feeding operations producing swine and poultry and other livestock, people who live there have been speaking out about their experiences, what it's like to live next to large, open, confinement buildings and large, open cesspools of waste from swine, thousands of swine confined. And so the research started, under my mentor, Steve Wing, who was at UNC in the Department of Epidemiology, just spending a lot of time listening to what it's like to be a neighbor of a large swine concentrated animal feeding operation and understanding and hearing the concerns include the malodors, the concerns about water contamination, that's surface water contamination, groundwater contamination, relaying experiences like, the malodor being unpredictable. And every day as you go out the door to either take your kids to school or go to work, you negotiate with the air. You're opening the door, cracking it to see, is that malodor there or not? The unpredictability of it. So it really was spending a lot of time listening to the experiences of the neighbors of these facilities. And that's sort of the crux. And then that's the starting point for any research questions, for any hypotheses. We as academics tend to go to a literature review search on a search engine like PubMed, and try to see if there's a knowledge gap and then say, hey, this is a research question that should be answered. But CBPR really flips that on its head, and it starts with those lived experiences of the residents in the neighborhoods where they're at the fence line of these large CAFOs. And so Steve was a pioneer in this area. He really did the work. That was a pinnacle example of this participatory partnerships with the communities at the fence line. And, he started off with just the basic tools in the toolkit of an epidemiologist with cross-sectional studies, answering questions whether, reports of, adverse impacts on the environment and health are in excess rates among people who live closer rather than farther away from swine concentrated animal feeding operations. And trying to do the best in that design where you're comparing two groups of people to try to control for those confounding factors, those differences between populations, which are always a challenge in those kinds of epidemiologic studies. And so that's where he started, and it really started to demonstrate clear excess and elevations in the prevalence of respiratory illnesses, of diarrheal diseases, factors that adversely affect, your mucosal membranes, your eyes, your nose, your throat, among the neighbors of these facilities. And it moved on to that same study design, which is sort of a good starting place in terms of it doesn't take a whole lot of resources, moving into comparing the same frequencies of different schools, children who go to schools very close to a large concentration of swine produced in CAFOs versus children who go to schools that are not as close, and seeing similar signals, elevated prevalence of respiratory diseases like asthma.
So I guess you can control for stuff like income, because there are low-income communities in the western part of the state who don't live near these kind of operations. You can do stuff like that, right?
Yeah, and that the team, Steve and the team, tried to compare fence line neighbors to swine and other CAFOs to other neighborhoods and other residents in rural agricultural areas of the state of North Carolina to try to adjust and try to control some of those vulnerabilities of a cross-sectional study design. Really, the brilliance was when Steve realized that there was a there in terms of an excess rate of these illnesses. And a lot of the complaints started and continued to be with the air pollution concerns from emissions from these swine CAFOs, is thinking about this longitudinal repeated measure study design that created opportunity for lots of conversations between people who were in community-based organizations, who were community leaders, who knew a lot of people who lived near the facilities, who eventually could become participants in these studies. This process of going through a longitudinal study where it was designed together with people who lived at the fence line, where the protocol was essentially, we're going to ask you for 14 days to sit outside your house on your porch and expose yourself to the air in the morning for 10 minutes and in the evening, and pick the same time in the morning and the evening. And we're going to set up a set of air monitoring equipment to continuously measure air pollution during that time. And then you can relate the coming and going of the air pollutants, which some of the measured air pollutants are highly specific to swine CAFOs, like hydrogen sulfide is a highly specific marker to swine CAFO air pollution. And you could connect that to people's self-reported experiences of being at their homes, enjoying their property. And going back to that original anecdote, this research question was around that story of negotiating with the air, never knowing when a malodorant plume was going to make it really hard for you to go and get to your car, to get to work, for your kids to get, to the bus and be able to, be standing out in front of their house for the duration of time that may or may not make it such that the malodorous smells absorb their way into their clothes, such that the stories the children were telling us when they get to school and they walk into the class and they find their seat and they sit down, that other children know where they live.
That's humiliating.
In proximity.
Yeah.
So those were the kinds of stories that Steve spent time listening and trying to think of the epidemiologic study designs, which could get at some generation of objective scientific data that might be able to answer the questions and, bring data to bear around those lived experiences.
And so Steve died of cancer 2017, is that right? And you and other researchers have sort of picked up the baton is what I'm looking for, and kept it going. And so generally speaking, let's talk a little bit about the demographics of the area. And we know that this is not something that people bought a house near a CAFO and are now complaining that there's bad smells coming from it. These are people who have lived in this area for generations, and starting in about the 1980s, really picking up steam in the 90s, it really starts to accelerate the plunking down of these CAFO operations. So can you talk a little bit about the demographics and what the research has come up with about that?
Yeah, absolutely. One of the first analyses that some of the people who were in Steve's group, and Steve tried to queue up or the research question of what are the demographics, and is there a disproportionate adverse impact of the location, the siting, the permitting of these swine CAFOs on people of color, people of low wealth, low income. And so that was an analysis that culminated in a publication in Environmental Health Perspectives in 2000 that showed a disproportionate impact. These facilities were disproportionately sited in communities that were higher representation of people of color and lower wealth. And so that was the mapping analysis really set the scene for this as an environmental injustice in terms of the disproportionate burden that's borne by people of color and lower income. So that's something that has been well recognized. And when you think about this in terms of some of the stages of this, that analysis essentially set up a lot of the discussion around statewide decisions with community requests for a moratorium, on permitting, new facilities until there was an answer to whether there was going to be a continued perpetuation of this trend of disproportionate adverse impacts of the permitting decisions for these facilities, which, in some senses, Steve and his group repeated around, I think, 2014 and showed consistency in that trend. And so, that's something I think is just, as the eastern portion of the state where these swine CAFOs are concentrated, and it's the agricultural area with the collapse of prior, premier products and crops like tobacco and others. It's really taken its root in that landscape of eastern North Carolina with those disproportionate adverse impacts.
And one thing that I've learned in my reporting on this topic is that this area was an area of really high, relatively speaking, high African-American farmland ownership. And as the 20th century sort of dispossession of Black farmland comes along, and basically, huge amounts of the farmland are lost due to USDA discrimination, due to just other problems of just discrimination, what you get is, basically white land barons buying the land and plunking CAFOs down on it. So if you're a resident in that area, African-American resident of that area, your family may have lost farmland over the past couple of generations, but you're still living on sort of a remnant of that land. And then all of a sudden, this new landowner is plunking down a giant hog operation on it.
That's absolutely right. And, this is an issue that, in this orientation, these principles of CBPR, having done work with Steve Wing and being around the table with people like Gary Grant from the Concerned Citizens of Tillery, North Carolina, different members of the North Carolina Environmental Justice Network over the late 90s into the 2000s, Elsie Herring. The story is very familiar, as you just described. The practices which often unbeknownst to the African American landowners can be revealed. Often, unfortunately, when it might be too late, that there is a threat to their ownership of the land. Elsie told this story many times over in her advocacy around these issues about threats to her homestead, where her mother, Beulah, lived. So, that is another part of the context, which, is critical as you start to develop or think about new research. Taking those experiences of the residents need to be the starting point and the input for how you design and think about research questions. Because otherwise, you could miss the big part of the signal, which is, part of the experiences of the residents. So that's a critical art, really, that Steve Wing practiced so elegantly. And went deep into the toolkit of advanced epidemiologic methods, causal inference thinking to try to think how you could design studies with, by, and for the residents of the front line and the fence line of swine CAFOs.
Okay, so now we've sort of set this picture of this incredible environmental injustice taking place to this day. This started in the 80s or 90s and it's ongoing. And now, so we should just say that there's, of the many, many issues with these CAFOs, one of the things that happens when you concentrate hog manure or other animal manure in such a giant pond, that you get releases of methane, and methane go into the atmosphere and are a heat trapping greenhouse gas with something like, I think, 20 times the heat trapping power of carbon. So it's a really, awful greenhouse gas. But methane is not one of the issues. It's not one of the issues that affects the community. There are many gases coming off of these operations that do affect the community that are very awful to breathe in. Methane is not one of them. But the industry, in its wisdom, has decided on a response to the environmental problems of CAFOs, and that response is we're going to capture the methane. So we're gonna address part of the climate change problem with these facilities by capturing the methane and turning it into natural gas that will then be burned as a fuel. But without addressing any of these other issues. And so, this is the methane digester idea. So let's shift to that question of how does this, innovation of methane digesters, which got a lot of momentum with the Inflation Reduction Act and, climate change spending in Congress, how does that affect communities just first off?
Yeah, I mean, that's a big open question at this point, because I think, what is currently, part of the evidence base are a lot of studies that come from, economic analyses or the convergence of academic economic departments or schools and agricultural schools, which are answering questions about, and actually we've known this since roughly the Smithfield Agreement in 2000 about the idea of environmentally superior technologies, right? Anaerobic digesters, biodigesters have been, as a technology, have been well known and recognized for some time. I think there was a recognition of sort of a price point, of a profit calculation, whether or not they could be profitable and what characteristics might be required and structures might be required to make them profitable, right? But what is not exactly clear to fence line neighbors within this conversation about an expansion is, classically, whenever there's an environmental injustice issue or experiences of residents, the request or the claim or the complaint is that whatever the economic profit calculation is, doesn't include the full accounting of the costs of the adverse impacts on the environment and health of the people living most proximal to the facility. So it's the same story, potentially here, that the residents are raising questions about and concerns that it could play out again. That the massive investments that are being discussed and potentially unfolding around biodigesters and methane capture and recovery systems could essentially solidify, harden, and potentially exacerbate the environmental injustices that have been well documented through Steve's first study of the mapping analysis and those published in Environmental Health Perspectives in 2000. And you have the added aspect of the intensification of recognition, concerns around climate change, and a sense that we need to come up with solutions. And there's a lot of discussion around the trade-offs and the benefits, where residents at the fence line again are saying, what kinds of data exist to assure us that if this anaerobic digester biogas infrastructure is developed, related to CAFOs, swine CAFOs and poultry CAFOs, will there be an accounting for the adverse impacts that we may experience? And so that's a big unknown and a huge challenge for residents as they're really speaking out about, with the first pilot projects which are being developed, and then they're, learning what is being cleared, adjacent to their property. And then once it's there and the infrastructure is built, sharing and relaying experiences around a table, just like Steve sat around a table with whatever academics would come and listen, and reporting that there are pretty substantial concerns with malodor, that there are certain times when there's a sound, or there's an off-gassing sound, but they don't know what it is, and then reporting malodors are related to that. So, a lot of the same questions that Steve Wing's group and collaborators in Iowa and others in Europe have really picked up to show, repeatedly that swine CAFOs and their emissions from legacy operations without any biogas methane recovery are associated with adverse respiratory and other health effects. You know, it's the question, will anything change with this technology? I think a lot of the community residents are paying careful attention to and reporting to us and others that they're seeing claims that it's green, that it's clean, and it provides economic benefits. And they're raising questions about clean and asking, shouldn't we be also asking if it's safe, and economic benefits for whom? And if they're included in that, you know, economic benefits for you know, that reflect our experiences. So that's a big area that we see from, you know, classic public health, the role of public health practitioners and epidemiologists and environmental health scientists to be able to partner and begin to think how we can investigate and generate data around those questions of the fence line community residents.
Let's take a step back, and I wonder if I can get you to talk through the state of North Carolina's 2000 agreement with Smithfield in the wake of this absolute disaster of Hurricane Floyd, which is in '98. Is that right? So Hurricane Floyd blows through in '98 and just grabs with this massive flooding and massive storms all of these lagoons, it clears them into waterways and just creates this giant mess that are literally dead hogs sloshing around rivers and streams and turning up and rotting. It was just, you know, basically the signal that this system is broken. After, you know, 15 years of, you know, accelerating and building up really huge, you've got this sign from nature that you can't keep doing this. And what happens in its wake? What is this agreement that takes place?
Yeah, so at the same time as that hurricane-driven natural disaster occurred, you know, Steve's work was coming out, and the answers to some of these early research questions about the disproportionate impact upon people of color and low wealth were becoming well recognized. And all of that sort of, you know, led to a lot of inputs for the community-based organizations like the North Carolina Environmental Justice Network, the Concerned Citizens of Tillery, and the Rural Empowerment Association for Community Health. This is Naima Muhammad, Gary Grant, Elsie Herring, Devon Hall, Dethula Barron Hall, who was a co-founder of REACH at that time, really coming together with the academics like Steve and others. Joanne Burkholder was somebody at NC State who was really active, and going to Raleigh, you know, going to the mall at Raleigh and you know, publicly testifying, you know, even when, you know, elected officials, you know, wouldn't hold an official forum, they were finding ways to publicly speak out about what the science and the data was suggesting and providing answers to, at the same time that there was this really massive natural disaster. And so those created the conditions for there to be public pressure to be able to inform a statewide moratorium on the issuing of any new permits, general operating permits for small and confined animal feeding operations to be issued. Around that time, there was also a negotiation to sort of, you know, provide an infusion of funds to also update the science and sort of ask the question whether through technological solutions could there be sort of a, you know, an adaptation, a different way of, you know, structuring these vertically integrated, you know, components of the industrial food and animal production system, which is, you know, colloquially referred to as the Smithfield Agreement, which infused funds. I was in a water microbiology lab at the time at UNC Chapel Hill. My advisor, Mark Sabzi, was taking on kind of the pathogens component of a lot of that Smithfield Agreement around those research questions. And it really, and there was a group at NC State that was working on the biodigester and anaerobic digester issues. So it was a moment where I think we the scientific community at least, put forward some, that technology, that science could offer some alternatives or some ways to alter the mode of production, including the economic and agricultural disciplines putting forward biodigesters, right? Now, ultimately, since that's been known since 2000, why weren't they adopted until now? You know, that's sort of as community residents and others have talked about sort of the economic, scale and the economic, cost points for it, to the best of my understanding. But, the Smithfield Agreement and that event really led to a coming together to face what could we do? What scientifically, could be possible to potentially change the way that pork is produced and swine are raised. So that's something that, now we're coming back, kind of swinging back to connecting to that knowledge in a way now with larger attention around, the infrastructure investments from this administration, and a lot of what the community are reporting about, ever-present materials that are either marketing or otherwise that are really making the case that CAFOs should be viewed as a green climate solution now. So why not invest in them with anaerobic digesters and other technologies? And the concerns of the communities that we're hearing is this a rationale to potentially argue for an expansion to, begin to go back to that question of how do you make these economically viable? And is economic viability from a profit standpoint requiring, increasing the number of swine CAFOs and poultry CAFOs to make this anaerobic digestion technology, more profitable or just, essentially profitable versus not?
Yeah. And so are you working on any research projects about living in proximity to these biodigester operations? And we should just talk real quick about how Smithfield has one in partnership with an energy company that is in Sampson County, where a previous guest, Sherry White Williamson, is from, that will collate, if it all goes according to plan, it'll collate the methane from 19 large hog CAFOs. Each one will have a pipeline going to the central facility, and it will gather at the central facility and purify it, because you're not going to capture 100%. You get pretty close, I think, but you're not going to capture 100% methane. Purify it and then send it into a natural gas pipeline. And what do we know about what it means to live near this kind of operation? And one thing I can say from my reporting, I've been reporting on environmental stuff for about 20 years, is that there's never been a pipeline that has ever been proposed where the company doing it said, this one won't leak. This one is going to be 100% leak proof. And all of them always eventually leak. That's just a rule. If you have a pipeline with gas in it, eventually things are going to wear down and it's going to leak. So what are the preliminary findings from this research?
Yeah, I mean, that's exactly what, conversations with our community partners in Duplin County, the members of the Devon Hall at the Rural Empowerment Association for Community Health. They have monthly DHAP meetings, the Duplin Environmental Health Awareness Project, and they're coming to the table asking questions of just along the lines of having read a little bit here and there about pipelines and wondering, how contained is it going to be? What is it going to be like to live in a neighborhood or, with interconnected swine CAFOs with pipelines of this gas material that's recovered from swine lagoons, and how will it change their life? How will it change, how they want to enjoy their neighborhood, their property, and their community? And I think it gets down to, a lot of the early research questions about the malodor were, making measurements to really dig into that, with measurements of malodor and compounds like hydrogen sulfide and ammonia that we know are produced by swine and poultry CAFOs. And I think it's similar here, is to what extent will this swine CAFO and other poultry CAFO biodigester, biogas infrastructure, biofuels infrastructure represent a hotspot, for people? And what will the frequency be of emissions that affect daily life, malodors? What are the magnitude? Is it going to be different than legacy swine CAFOs and poultry CAFOs? If you're concentrating this methane, one of the things that you mentioned earlier that's really important is the idea that methane itself is not malodorous, but it travels along with a complex mixture of gaseous compounds, right? From an open swine CAFO lagoon, from the confinement buildings and the ventilation fans. So Steve always reminded people about that idea that we're measuring an indicator gas, which represents, a broader complex mixture, which could include methane. So if the goal is to capture and recover methane, but you're also capturing that complex mixture of compounds, and you're concentrating it in pipelines and then concentrating it in storage tanks of varying size or scale, and people live, hundreds to maybe 1,000 feet from a large storage facility, which is maybe going to need to be, in terms of the infrastructure, a hub, an interim hub, in order to be able to purify it and take it, convey it to a larger natural gas pipeline. What is it going to mean? What is it going to be like living next to that kind of infrastructure in that facility? And if there is a release or an emission as a part of maybe any slight deviations from best management practices, or potentially routine operation involves some periodic releases, what's that going to be like? What are the plumes going to look like? Methane potentially could be a part of that, but what levels of hydrogen sulfide might residents expect to see? Will it be commensurate with what was already demonstrated to have adverse respiratory health impacts and adverse impacts on health-related quality of life in Steve's panel studies, like the CHEO study, right? Or will it be higher? And so those are some of the starting points for our research now, where we're making measurements in real time around the areas where this infrastructure is being planned and where pilot projects have already been developed. And so preliminarily, we're seeing that these facilities can be significant sources of emissions of methane, hydrogen sulfide, and ammonia. And, so we don't have the answers yet about the average frequency or what's typical, right? But the starting point is there any evidence at all that this infrastructure, this biofuels infrastructure, could represent a hotspot for neighbors? And so for that research question, it's quite clear, and it's orders of magnitude higher than what residents were, at least what was measured during the prior EPI studies that Steve conducted with community organizations like REACH and the North Carolina Environmental Justice Network and Elsie Herring and Naima and Devon. So I think the concerns of the residents, preliminarily look quite real and quite valid, and start to usher in the next questions about that community residents are raising. If this infrastructure is not going to be benign and clean, safe, and green, then, if there are adverse impacts, then the question of economic benefits for whom really becomes front and center. And can we work together? Can we partner to complete the science that could inform some of the answers to questions for, what kinds of solutions could address the fence line environmental and health harms of this kind of infrastructure?
I mean, one thing that is just shocking here to me is that these are well-established scientific conclusions made over decades that these cause elevated harms in these communities. Yet we have an environmental protection agency that's on the national level. We have North Carolina's got its equivalent of what is it called in North Carolina?
Department of Environmental Quality.
Yeah, the Department of Environmental Quality. And yet this industry is so powerful, and its power in the NC legislature cannot be underestimated. I mean, just to give a quick example, some of the very citizens that you're talking about, who worked with Steve Wing over the years, banded together and filed nuisance lawsuits against these companies, against Smithfield, saying that their quality of life is being harmed by this. They won the suits. They were awarded money that ended up getting knocked down, but a substantial amount of money. And instead of it causing any long-term change, the legislature of North Carolina went in and changed the law to prevent future nuisance suits. That is the kind of power that we have, that this industry has. And on the national level, whether it's Democrats or Republicans, the Biden administration and Tom Vilsack are very enthusiastic about this. The USDA secretary are very enthusiastic about this technology, that it's going to green industrial meat production. And so what we're left with as we continue the long struggle to fight against these, which becomes a political fight, is a question that you've been raising through this conversation of economic benefit for whom. And if these are going to be this big economic benefit, if they're going to generate money from, what do they call them? Carbon offsets, that the carbon offset market that's building up, if they're going to generate money from literally selling natural gas, if they're going to be sort of like this boon to the area, how do you make that be enjoyed by the community members themselves? And so this is part of me just like rebels against this idea, because why do we accept it in the first place? But part of me sees it as necessary. Like, these are low-income rural areas that don't have very well-funded schools, don't have very well-funded healthcare systems, could use some resources. Talk me through this idea of sort of charging freight and, giving money to the community, that giving a portion of the money generated from this massive industry to the community.
Well, so this is something that the community partners that we work with, and it's actually, a pattern that's, broader than just this industry, right? So, as a part of my work with Steve Wing, at UNC Chapel Hill, which is itself located in, Orange County, North Carolina, whose municipal solid waste were being disposed of in the Orange County Regional Landfill for decades. And Steve and I worked with the community there where, they were seeking answers to research questions that were very similar to the negotiating with the air at the fence line of swine CAFOs, but it was malodors from a landfill. And we were able to adapt that repeated measures longitudinal study design that Steve implemented next to swine CAFOs at the landfill, Rogers Road community, with Minister Robert Campbell and David Caldwell, Barbara Hopkins, and many other wonderful residents.
And is this once again a heavily African-American?
Historically African-American community, extensive histories which were elegantly done, showing that some of the residents inherited the deeds to the land that were issued from the King of England, and these are African-American landowners throughout all of the hundreds of years in just north of Chapel Hill. But, the landfill for the entire county, the universities, and the adjacent municipality of Carborough, I've been there for when I got involved, around 30 years, And it was the same moment where it was announced that a realization that landfills were sources of methane gas, and that you could partner up. Municipalities and local entities could partner up with energy companies to recover methane and to assign a rate fee to potentially monetize it and think of a profit scheme to basically recover methane. And it was, again, brought forward as within the renewable or a climate-friendly solution. And I'll never forget Minister Robert Campbell and David Caldwell saying, if there's profits coming out of that landfill, some of it better come back to the community, because we've lived with it for 30 years. All of the fears and concerns and legitimate documented evidence of, drinking water contamination, surface water contamination, and malodorous air pollutants. And so that was, part of the community request at that time. To my knowledge, it wasn't successful, but this is sort of a classic position, which I think is just sort of a universal humanistic perspective. If there's adverse impacts and harms that can be objectively characterized, should there not be a sense of remuneration, right? And so I think it's very similar here with residents, as clearly, publicly, is being stated from local levels in North Carolina to other states where there's intensified industrial food animal production, to a national level at climate solutions. If there's discussions around, capturing and making industrial food animal production systems somehow green under a economic benefits model, that the decades of science that has contributed to recognition of the environmental harms, the public health and health harms that have amassed, should warrant some discussion of, could there be remuneration? Could there be, if there's profits to be had, could there be some compensation for residents as they're undergoing this transition, which in their concerns we're hearing around the table could lead to actually, justification to expand industrial food animal production facilities, their size, potentially, their numbers, in terms of revisiting permit decisions around different state levels. So that's what we're hearing, and I think what we recognize within that is the need for detailed studies of exposure at the fence line, environmental conditions, environmental impacts, and ways to connect and in very meticulous ways relate those exposures to health states, health endpoints, among the people who are going to be dealing with these transitions in this infrastructure.
And then to sort of, once that is done, push for some kind of freight to be charged. And is there an idea of how that would work? Would it go into like county tax coffers, or how would that go?
Yeah, so that is what we're hearing, is that the community residents would like to have some compensation, per unit compensation. If there's a unit of methane to be harvested or produced, that there would be some kind of a negotiated rate, to be direct payments back to the fence line neighbors. Whether that's to community organizations, whether that's to a collective fund, or a government entity or a nonprofit entity, I don't know. And that probably is something for the community residents and guests to be, speaking towards. But that's the general idea, is to be able to have some positive opportunity for positive investments at a scale that's meaningful to help residents who've been living there for decades, and been contributing to the economic base of North Carolina and other states for decades, if not, over 100 years, to continue to meaningfully enjoy their communities, as a transition like this is, poised to potentially unfold.
Well, Chris, is there anything else that you want to get out that people should think about on this issue?
Yeah, I mean, I think it's just something that can't stress enough to really, as you're really thinking about this issue, and often when I find myself in conversations with family members around, whether now there's sort of a green solution, a green climate solution for some of this, just to really not forget that perspective of green and clean and economic benefits for whom, and to really spend a lot of time allowing that to think about collectively, society, what role we play in an intricate, interconnected, food system. So that's something where I think really having an opportunity for science that's from the public health sciences, from the exposure and epidemiologic standpoints, to be meaningfully integrated into academic, agricultural, and economic sciences. I think that's one of the most important opportunities as we weigh this big infrastructure transition, and view it as an opportunity, and an opportunity for whom, and positive impacts for whom.
Yeah, and I'm thinking that this is a microcosm of something we're going to be seeing a lot as our political system finally starts to deal with climate change and starts to take it seriously and make policies addressing it. There's going to be a big battle over whether the solutions that come up are able to sustain the current system and even make it more profitable, or actually change the current system and unwind some of the problems with it. And I think that, with things like carbon markets, with things like a lot of the IRA funding, that's the Inflation Reduction Act funding, stuff like, carbon capture, which is basically, we'll just keep doing the same thing and capture some of the carbon like we're doing now with methane. I think there's going to be a lot of battles over whether these are really benefiting communities, whether they're just sort of isolating the climate part of it and leaving all the other damages of various different industries intact.
I think it's really important to recognize the high level of organization, the sophistication of community groups that are living in, CAFO country in North Carolina or other states, where they have a vision and a model for producing, livestock and, consumable animal protein. But it's just very different than the vertically integrated system of food animal production. And if there were real meaningful opportunity for economic benefits to be put into sources of funding for residents who could be, they could be the leaders of an alternative model potentially, and just have an opportunity to potentially see a different vision for food animal production. This is something that, the analogy is in some of our urban community partnerships in Baltimore. It's around development decisions and, kind of the model for development with, from the ground up and communities and forming land trusts and creating economic systems that can be vibrant and locally accountable versus, and not displace residents who have historically been living there in neighborhoods like Curtis Bay, versus other models of redevelopment that displace a fair amount of the population that's historically been living in areas. And so it's just similar to the landfill example in Chapel Hill, North Carolina with Rogers Road, asking for remuneration benefits for, to come out of the adverse impacts which have been borne. It's the same idea, whether it's landfill malodors and adverse impacts on water and air, whether it's swine CAFOs or whether it's, an urban industrial landscape like Curtis Bay, South Baltimore. The request there is also, could there be a per good moved or transported or stored unit, payment back to the community for an alternative to the legacy industrial model of this is going to be the need for a larger municipality or region, and this is going to be the location where that industrial, locally unwanted land use is going to reside. Is there an alternative to that? And so part of this is recognizing the sophisticated, highly organized alternative visions and alternative plans of community organizations, be it urban South Baltimore, be it, Eastern North Carolina, or, in neighborhoods adjacent to major academic centers. So that's something I think also that Steve did time and time again, was just recognizing that as a seat of power and, seeing how we could design science that could bring voice to those lived experiences and try to, envision some alternatives to the way that we construct, the way that we design, and the way that we promote environmental and health in communities and neighborhoods.
I gotta say, it's such an inspiring way to be an academic because it's not up in the ivory tower. It's going out into the community, getting community input, and then creating science that serves that community. It's just sort of the opposite of the stereotype cliche of the academic off, in the ivory tower doing science for its own sake. And so I really appreciate the legacy of Steve Wing and that we have someone right here associated with CLF, keeping that torch lit. So I just really appreciate it. And I guess we'll have to leave it there. But thank you so much for coming on Unconfined podcast.
Thanks so much, Tom. Appreciate it.
This is an episode of Unconfined, a podcast of the Johns Hopkins Center for a Livable Future in Baltimore, Maryland. You can find us online at clf.jhsph.edu.